بشرح لي صدري ويسر أمري واحلل عقدة من لساني يفقهوا قولي. My name is Sabika Zehra and I'm from University of Karachi. Today, the topic of the presentation is the spectrum of electrolyte imbalance and oxidative stress analysis in human suffering from sepsis. Sepsis is basically the decomposition or the biological decay of the body which cause inflammation and blotching of the skin. Pediatric sepsis, which occurs in the children, it is mainly occurring due to the blood infection and it's divided into two um, types, early onset and the late onset. If it is occurring in a first week of life, so it's early onset, but if it is occurring after week, during 3 months of the age, so it's called a late onset. If we talk about the pathophysiology of sepsis, so there are three factors: damage-associated molecular patterns, pathogen-associated molecular patterns, and viral proteins, which infect the cell and results in the alteration of the gene expression, which results in the production of cytokines, chemokines, complement proteins, coagulation factors, etc. Electrolyte imbalance. Electrolytes are present in our body. If their amount or if their level got disturbed, so it referred as their imbalancement. There are certain critical disorders such as severe burn, trauma, sepsis, brain damage, heart failure. These things could lead to the disturbance in the fluid and air electrolyte hemostasis. Here we are only discussing the four main electrolytes which we have worked upon in our research. Firstly, the sodium. Low level of sodium is called hyponatremia, would occur due to dehydration, prolonged vomiting, etc. High level of sodium is called hypernatremia, could occur due to overhydration, poor nutrition, etc. Secondly, the potassium. Low level of potassium is called hypokalemia, could occur due to eating disorder, having certain medications. Whereas the high level of potassium is called hyperkalemia, could occur due to adrenal insufficiency, kidney failure, severe acidosis, etc. If we talk about chloride, so low level of chloride is called hypochloremia, which is occurring due to kidney failure, severe dehydration, metabolic acidosis, whereas high level of chloride, which is termed as hyperchloremia, could occur due to metabolic alkalosis, diuretics, etc. Bicarbonate, the high level of bicarbonate is called hypercarbonatremia, would occur due to metabolic acidosis, chronic respiratory alkalosis, whereas low level of bicarbonate is called hypobicarbonatemia, would occur due to vomiting, dehydration, and etc. Oxidative stress, which is a bodily condition which after when antioxidant levels are too low, could be measured by the blood plasma. When there is imbalancement of the reactive oxygen species, which are called free radicals, so we consider that a body is experiencing oxidative stress. The hypothesis of a research is hypothesis is saying that sepsis in children results in electrolyte imbalance, which could result in aggravation of the symptoms. Secondly, oxidative stress is a key player in development of the sepsis. It means that sepsis is based on two things, or sepsis is causing two things basically. One is electrolyte imbalancement, and second is oxidative stress. Aims and objectives of our research are like this research will provide the baseline data for pediatric sepsis in Pakistani population. Secondly, it will provide electrolyte estimation in sepsis children. And lastly, the oxidative stress evaluation in the sepsis children. We carried out the research work in a flow of like firstly we collect the samples, then we carry out the electrolyte estimations of those samples, then we carry out the kind of catalyst inhibition test upon them, then glutathione reduction test, and after having the results from all these tests, we conducted a statistical analysis of these results. The results of our work shown us that sepsis is more common in the children of 0 to 1 year than from 1 to 5 years, then from 5 to 15 years. And if we talk according to the gender, so it is more common in the females rather than males. These are the graphical representation which are showing the electrolyte levels in control in the sepsis subjects. So sodium level got elevated in sepsis, whereas potassium level got decreased. Potassium level also got elevated. Chloride level also got elevated. Only the bicarbonate levels got decreased. They are showing the altered sodium levels. It shows that there is no such difference in the presence or occurrence of the hypo or hyper natremia. Altered potassium levels showing that there are more patients of hypokalemia rather than hyperkalemia. Similarly, there are more patients for hyperchloremia rather than hypokalemia. If we talk about the bicarbonate levels, so in bicarbonate, we also have more patients or more percentages for hypobicarbonate rather than hyperbicarbonate. This is a graphical representation of catalase inhibition. It shows that in sepsis subject, the catalase inhibition is more than control, whereas glutathione, the glutathione concentration decreased in the sepsis subject. Where all this research work would reach to the conclusion that in sodium levels are not significantly altered in sepsis children in comparison with the control, whereas hyperkalemia sepsis subjects indicates that kidney dysfunction, acidosis, hyperchloremia in sepsis subjects indicates metabolic acidosis, kidney dysfunction, renal dysfunction. Hypobicarbonatemia in sepsis indicates metabolic acidosis, chronic respiratory acidosis. Moreover, increased catalase inhibition during sepsis indicating increased oxidative stress, and secondly, overproduction of acids. Besides this, decreased glutathione during sepsis indicate increased oxidative stress. Here are the references, and in the last, I'm thankful to the Department of Biochemistry, Dr. Bina Hassan, Dr. Shubir Khan, and all my friends and family who supported me during my research work, and thank you so much.